For people in our community, nutritious and culturally appropriate food is not always easy to come across. And this is food insecurity, and certain circumstances in one's life can make a person more susceptible to it. Things like generational poverty, the increasing cost of food, or lack of education around nutrition are some of the factors. COVID has also pulled the rug under every aspect of our daily life in Melbourne, including the food system. It's slowed down the supply of food to organisations, including supermarkets and charities. Today we discuss how local organisations have joined forces to create new pathways for communities to receive that food assistance. And we discuss how they removed barriers and stigma, and how they even empower those in need to grow their own food in small city spaces. All right, let's get into it.
Hi, my name's Sally. I work as a community development worker at Belgium Avenue Neighbourhood House for the North Richmond Community Capacity Building Initiative.
Hi, my name's Peta Christensen. I'm the Food Systems Team Leader at Cultivating Community, and we work in community gardens and other community food programs on public housing estates.
I'm Tom. I'm the Community Food Project Coordinator here at North Richmond Community Health. I also manage our Café here.
So the word food security has become a bit of a buzzword the last couple of years. I'm wondering, what does the word food security mean to you?
Kind of maybe food security becoming more at the forefront of people's minds. I can think of like 6 years ago, we used to do film nights at a place in Hackney, and people used to come and bring food donations for the food bank. And maybe food security may have been something that was people went to food banks for, so it wasn't as kind of widely known about. And now places like Belgium Avenue Neighbourhood House and other community organisations have been doing things that have been really widely accessed by people. So more than going to a food bank might have been something that was quite discreet, but now it's like becoming more open, that people would come and access something for a very wide variety of reasons. And like I said, the social connection side was a big part of that.
I think that's a really good point, because I think similarly here in Australia and in Melbourne, food banks probably, not that they were necessarily hidden, but they were, people would be going there specifically for food relief. Whereas with organisations like Belgium Avenue and North Richmond Community Health and Cultivating Community, we started doing food relief really for the first time. And I think that's what the pandemic brought out, was there was a need in the community, and that need was always there. I think that need, was relatively unfulfilled or inadequately fulfilled by the other emergency food relief that was available. However, it became, more to the surface over the pandemic, and the need became so obvious that groups, and organisations had to step up and do that work. And also, as you say, Sally, it's kind of like it was the only thing that we could do to stay connected with our community as well. So it sort of served that double purpose, I think. Yeah.
So I just want to talk a bit about culturally appropriate food. Is it simply to cater to preferences for food, or is there a deeper value or intention in providing the culturally appropriate food? Because that's a service that everyone provides here. It's not just... I don't know what to call it, Anglo-centred food. Yeah,
I think it's really important to value people as individuals and their personal beliefs or preferences. So if we were doing barbecues, we'd have halal meat, for instance, because it would exclude people if we didn't have halal meat, for instance. And just really, valuing people's beliefs and their dietary wants and needs, and things that are important to them. Like I'm from the UK and I love Marmite, not Vegemite. So for me, that will bring me some level of comfort to have Marmite.
I'm with you there.
Yeah, absolutely.
I think it's all about understanding people as individuals and not just grouping people into something so that's the easiest thing to do, some hot chips or something. No, let's do something also that's created by the community. And the community knows best what they want and like, and so if that can be cooked up by people from the community, that's the best thing, really.
And also that if you're providing what people want, it's not going to be wasteful, because I think one of the things that we really found is that, there's no point putting food in a bag that that people don't want or don't know how to use, or it's not part of the way that they cook or the things that they eat. And so we really sort of tried to think about that when we were growing food through Moving Feast for the food relief packs as well. So sort of thinking around Asian greens, and we got feedback that lots of people weren't that into kale. So so stop putting it in the bags, and that's we'd have to kind of listen along the way as well, and adjust.
And food is like part of well-being, as Sally mentioned. You eat what you want because it makes you feel good, as well as being nutritious. And I think, like for food relief and food security, it's about getting food that's appropriate for your, whether it be your personal belief or your religious belief. If you're from a culture that doesn't eat gelatin, for example, you might want to save that for the next person that's going to eat that sort of thing. But if you've got an option that doesn't have that, then it's going to help your well-being, not just satisfy like your needs if you're hungry, but actually, satisfy your personal and religious beliefs as well. Yeah.
And in addition to that, I think the other thing that we really tried to do with our food relief and packs was to ensure that they were dignified. So, much of the food that we had to distribute was rescued food from organisations like Second Bite and Food Bank and Oz Harvest. And so we were very careful to go through that produce to make sure that what we were distributing was really as fresh as could be, and then to be able to top up with stuff that was grown in Alphington or at the Collingwood Children's Farm and was just bursting with, freshness and vitality, meant that we, that to be able to give those bags that were clearly grown and made with love and had good food in them was also very important to us.
Absolutely. Yeah, like if you were struggling and all you could eat is just like McDonald's and, deep fried food, that's not actually food security, because it's not nutritious and it's not quality and it's not actually going to sort of help you long term. Food security is having, like, I guess, that abundance of things that are going to help you. And knowing where it's going to come from, and knowing that, you'll get your next meal in that way.
On the topic of cultivating community, actually, you've got so many great food security programs running, but in particular, you've got programs about developing life skills and growing culturally appropriate food. Can you tell me more about the programs you've got going on at the moment?
Sure. So I guess one of our main programs is our community gardens. So we've got around 20 gardens on various public housing estates around Melbourne, including 2 in Richmond. And in terms of food security, that people are able to grow their own food. So they're not having to rely on the food relief or, even going to the supermarket. And, we see that as increasingly important. Like at the moment, if you go to the supermarket, many of the shelves are pretty empty. Yeah. But if you are able to grow food yourself, then, obviously you're going to have that, you're in control of that supply. And you're also able to grow what is appropriate to you and what you like. And actually, in many of our community gardens, you'll find herbs and vegetables that are, specific to different cultures that you can't buy in the certainly not in the supermarket. You probably could find them on Victoria Street, but they're not widely available. Yeah. And also, the gardeners in our community gardens are so skilled and, really amazing food growers.
And how do the gardeners get involved with the
gardens?
Yeah, what happens there?
So, the gardens are really visible for people who live on the estate. So if anybody wants a garden, I think, the process is that they'll approach the support worker or ring Cultivating Community, and then we'll go through a process where we've got an application form, and you may have to wait if there's not a plot available at the time. And hopefully it's not too long. It might be a kind of, 6 to 12 month wait, because they do, people do move and the plots do become available. So that's the process. If anybody is wanting a garden, please get in touch with us.
Can they sell that commercially, or is it just for their own?
No, it's for your own family or household, or you can certainly share with your friends and neighbours, but it's not for commercial use.
Yeah. How big is the plot?
They are around like 2 by 1, 2 or 3 metres by 1 metre. You can, grow a surprising amount of food in that space. And, as I was saying before, the gardeners are so skilled. They really use every inch of that earth to produce a bounty of food.
It's a hot day. I'm at the community garden at North Richmond Community Health, and it's like a mini jungle in here. There's lots of tall palm fronds hanging over you, the smell of barbecue in the air, and the smoke is coming from the wood fire oven here in the community garden. And I've actually met one of the gardeners, and she's kindly offered to show me around her garden plot in this community garden.
My name Anna. Yeah. I'm from East Timor. This one tobacco tree.
What
Some
is that
people
one?
never know. Tobacco.
Tobacco. Oh, wow.
Yeah. We grow and I tell my friend, look, this tobacco is looking like. He tell, how do you make the tobacco? I tell, my grandma will make tobacco. I can make this. Not very good. This pumpkin. We eat the pumpkin seed. They leaf like this, young one.
Japanese pumpkin?
No, this pumpkin, just like the
Normal pumpkin?
New Zealand normal pumpkin.
Yeah.
This our tomato. This one aruda. This one smelly. This our bush medicine. Like we wear a cough, you boil in the water, broken one piece, dip in the water, pep tea.
It's medicine for when you have a cold.
Yeah. High fever, everything they gone. The kids, little baby, got sore belly. We rub this with onion to belly. Very, very hot.
So this is your plot of land, is it?
This one,
is it?
yeah.
This is your corn?
Yes, this is my corn. Holiday broken. This not the corn, the Australian. We call it maize. Australian call it maize.
Maize?
Yeah. Okay. We eat more the powder. Like Australian corn, sweet corn is you eat like the more water, more sweet. Yeah, this one more flour. Like we eat more flour.
More flour.
Yes.
How long did it take you to grow?
3 months.
3 months.
3 months ready everything.
It's so tall.
Yeah.
Yeah.
Then we can eat already. We can roast, we can boil in, we can make soup, corn soup. Then we can we can eat the pumpkin leaf, this leaf, pumpkin flour. All. My country, we live in the farm. We grow in rice farm. We working hard. Now I'm 74 soon.
You don't look a day over 50.
Yeah. I have 9 grandkids.
Wow.
I have 5 kids. I'm proud. My kids, everything is good. Yeah.
How long have you had your plot of land for?
Here?
Yeah.
I will here maybe 5 years now.
5 years?
Yeah.
Yeah.
We in this
And do you share with other people?
Yeah. We say with all friends all day.
Do you ever have to go get food from the store, or do you get all your food from the garden?
From garden here, yeah.
Just the garden?
Yeah.
Very useful.
Yeah, Australian is good. Like, you really hungry, you go knock somebody door, people give you bread, people give you clothes.
Yeah.
My country know who give you. We all passing around to finish. Now I'm here. I work in before I live here for 40 years. I need bring my kids all here, bring my mom here. My mom don't like. I bring back my mom go. Then every year I have my sister, my brother. Like in here calling two house. My country calling house. We live there. These 2 houses there, we live there. We very happy. Yeah. We got the bed sleeping. We cook outside the tree. Finish to come in. Yeah. We happy. We never see something more than good. See.
Thanks to Anna from the Cultivating Community Garden for showing me around. And we're back in the studio again to continue the conversation with our guests, Tom, Peter and Sally.
We did mention like the individual plots that are like 1 by 2 meters for all the residents, but we didn't really talk much about the big community garden at the front of like 139.
Yeah.
Like, how do people get involved in that?
Yeah. Yeah, so at the moment you need to apply for your own plot within the community garden.
Oh, okay.
And then you fill in an application form, and then you get a key. There's a fee. I think it's $30 a year, or something like that. And then you can access the garden whenever you want because you've got your key.
But you still have your own individual plot within the
You still have your
broad
own
garden.
individual plot, and then there are communal areas within the community garden, and then the gardeners, work out together with the garden worker, how's best to manage those plots. So they might grow food for food distribution, for example, or they might grow, fruit trees, or or herbs, or things that can be more communally used. But I think, in addition to, this sort of idea of communal garden spaces, which is different to community gardens. So community gardens being more plot-based, but communal gardens being more that anybody can come and access the garden and be part of that there are plans for some of those, some communal gardens to be around the North Richmond estate as part of the developments that are happening over the next year. So I think that will be, that's a really interesting model as well, so that, because not everybody wants to have a community garden, and, some people just want to come in and out and garden, together with other people, or, in a more ad hoc way. So I think there'll be more of those opportunities to come in North Richmond.
Thomas, you run the Café at North Richmond Community Health, which is kind of a unique position for a cafe to be in. Most cafes are focused on just getting as many coffees over the counter as fast as possible. So I'm curious as to how your unique position has positioned you in your role as a cafe manager.
Yeah, so I guess our cafe is pretty unique. Firstly, as you said, I guess turning a profit isn't the absolute number one objective of the cafe, although it is important, and it will keep me in the job, I'm sure. But I guess it comes down to three things with our cafe. Firstly, because it's in the community health centre, it's one of the purposes is to be affordable for the whole community. So the prices are relatively low, and we can do things like create a pay-it-forward system. So someone who has a bit more expendable income can come to the cafe and maybe pay for the next person's coffee who wouldn't have so much. So we can try to keep things relatively affordable for everyone. We're also, the cafe is managed through the Healthy Communities team, which I'm a part of, and we're linked with health promotion. So we're trying to make our cafe as healthy as possible. And we're working on systems to be able to sort of label our most healthy food, all the way to the little sweet snacks that you just want, a couple times a week for a bit of a sugar hit as well. But be able to provide really nutritious food for everyone in the community. And then I think one of the most important things as well that we can do there is be really, really diverse with the food that we provide, and really, really respectful to everyone's cultural needs. Have those halal meats available, have those vegan options. Another great thing about the cafe there is that we're positioned, for those who don't know the cafe, we're right there. As you walk into the community health centre, we're just on the right-hand side with a big alfresco area out front as well. So it's really, really visible. And I think throughout the lockdown, I've really seen how it's a safe place for people to come and have a conversation. During the lockdown when everything else was closed, but the community centre's open, and the cafe stayed open pretty much the whole time through that, maybe closed for maybe a month there or so. But otherwise, we were there to be a place for people to come and build those sort of social connections that they're missing out on.
Yeah.
Which I think was really important. And that's what cafes do, They're not just about food, they're also about social connections. So for us to be able to do that in an environment that's like really, really diverse, and be able to provide food to all those different sorts of people at affordable prices is what we're able to do there. And moving forward, we're finding opportunities to include members of the community to cook a whole lot more. So we'll be setting up what's called the Community Kitchen Connect, which will be a program where members of the community can cook for the community. They can produce meals that we can sell through the cafe, and the funds go back to them. And utilize our kitchen there that's been relatively underutilized since I've started here, to be able to grow that into a hub for these community members to cook their amazing food, because as we all know in this room, there's some amazing cooks out in our community that cook meals that I've never seen before and haven't tasted anything like that, because it's, you know, really traditional recipes from where they grew up, or their parents' generations have passed those sort of recipes down. And they're really proud of those sorts of meals, and to be able to give them a place to cook those and for their community will be awesome. And obviously, I should mention that BANH is already doing something very similar. So we're obviously just trying to work out a way that we can work together and, you know, increase that even more.
So these organisations, they usually kind of operate in silos but independently. So did you notice that the level of collaboration would have come together in the food support industry?
Absolutely. I think it's a collaboration that probably wouldn't have been there until you're thrown into a dire situation where the need is really present. I think that these lockdowns have kind of almost forced us to be a little bit more proactive with building those sort of like social connections and relationships. When I started in this role that I'm in, one of the first things I did was try and reach out to the other organisations in the community and say, hey, what are the food needs here? Because I don't currently know. I'm new to the area. I don't know what's important. And we were lucky enough to set up a little group with members from Belgian Avenue Neighbourhood House, like Connor and Sally, and Julia and Eloise and Gemma from Cultivating Communities, and a few other members from North Richmond, to just sort of talk about, well, what are the needs of the community? Because the best way to find that out is just by actually having conversations with people from the community and who are already doing that same sort of work, rather than trying to do everything yourself and doubling up on what other organisations are already trying to do with help. We're going to work better together.
Okay, here we are at Belgium Avenue. We're hearing music from Tanzania, and it's a drumming workshop presented by Missouri Dance. Kids and their parents come here to play the drums and eat lots of fresh fruit and other things they cook up here at Belgium Avenue.
What's your name?
Kingston.
Hi, Kingston. What's your favourite pizza topping?
Pineapple and ham.
That's a controversial choice, but I hate that. Yeah, it's a good flavour. And have you ever had pizza here?
No, not just yet, but I think I'm going to. I think today.
Oh, today? Are you going to make it?
No.
No? You're going to get it made for you. That's pretty lucky.
Yep.
Yeah. What's your name?
Mary.
We've been talking about healthy eating today. What's your kids' favourite food?
Well, I wish he would like more fruits and veggies, but Eli loves chips, hot chips, and he also loves fruits as well.
Yeah.
We need to work on a vegetable part.
Were you able to access any of the food services at Belgium Avenue?
Yes. Yeah. I think every Wednesday. Yeah, I think every Wednesday they were handing out fruit and veggies, and so yeah, we were able. It's easy access. Yeah, we were able to get some.
Yeah. Did they have the types of foods that you were after?
Yes, they do. They have fruit and veggies, which is great. So yeah, we're able to access, and yeah, we can just come here to the factory and grab every Wednesday. So.
We're back in the studio for the third part of the interview.
Tell me about how you included COVID, you disseminated COVID information with your food support programs.
We had the North Richmond Community Health Hurrah team come along, so they'd be sharing lots of information each week, encouraging people to get vaccinated and kind of getting a sense of how people were feeling. And yeah, that was a key partnership in us seeing people and being able to deliver the food security and being able to get those health messages across. And I suppose because it was over such a period of time as well, there was opportunities to build trust with people as well, that because you're seeing them frequently, it's not just a kind of one-off, you should do this or whatever. It's kind of like, even if you don't speak the same language, you're able to build rapport and relationships and recognition. So
Yeah, and because it was also, I think, ever-changing, wasn't it? So being able to have that kind of up-to-date information and in language and sometimes with interpreters was really helpful for people. I remember one day I had someone that came with a letter and they were really unsure about what was happening because they had a letter from the department to say that there'd been traces of COVID found in the water in their building, and then they took it to mean that they couldn't use the water in their building. So, just some of those little translation issues that we might not realise, but we were able to kind of sort out through that weekly, as Sally said, that sort of relationship building and trust. And also working with the Yarra Libraries team to help people put their vaccination status onto their phones or to print a hard copy. I think that otherwise would have been very, very difficult for many people.
Yeah, having a community event, even something as simple as food relief, is an opportunity to have all those sort of people that have those sorts of questions, have those questions answered in a space where everyone's available, and there's also another reason for them to be there. Like, it's almost an incentive. It's like providing a service and then being able to get that important messaging across at the same time. That's one thing that food can do.
I just want to finish off by asking you, who can access the service? Is it for anyone, or is it just for people in certain circumstances with a healthcare card? What kind of invitation would you put out to people?
I'd say currently we're not running the programs that we were running during lockdown. So the kind of weekly food distribution isn't happening right now, but we are doing a caravan on a Friday, which Cultivating Community make the amazing bread at. And that happens on a Friday from 12 till 2. And there's things happening a couple of times a week in Collingwood as well. But I mean, for the project that I work on, it's predominantly focused on people who live right here in the North Richmond housing estate.
Yeah.
But yeah, BANH services are accessed more widely than that as well.
Our food relief market is currently once a month, so it's the second Friday of the month on the Fitzroy Public Housing Estate, and that's open to anybody.
Yeah.
But programs like our community gardens and some of our other community food programs are for people who live on those public housing estates, and anyone can come along and bake with us on Mondays in Fitzroy too.
And yeah, our cafe, as I said, is part of the North Richmond Community Health Centre, just inside there, and we're open from 8:30 till 3, Monday to Friday, and anybody from not just the community but broader is welcome to come and try our coffee, try our food. We'll be open for you.
So the last couple of years have been particularly hectic for everyone who works in food security. What kind of message would you have for everyone you've worked with in food security?
Maybe just a massive thank you to everyone who supported the food programmes, from all the organisations, all the volunteers, all the community members that came. Like it was massive. And yeah, we just thinking back to what Peta was saying about culturally appropriate food and giving people what they want, otherwise things will get wasted. And yeah, I think kind of understanding and asking people what they do want, and then feeding that back to people that were wanting to make donations, like Igniting Change. Say they'd ask us what are the top 5 things people want. So really trying to be as responsive as possible. But yeah, just huge thank you to everyone.
I'll say a bit of a thank you to the Healthy Communities team. The health promotion really help us to be able to provide the right sort of foods for people as well. And if anyone wants to know more information about the health services that we have available, come and chat to us at the cafe or reception at North Richmond Community Health, and we can definitely point you in the right direction.
I also wanted to absolutely thank all of the people that have contributed to food relief, but also to say how exciting it is to have been connected with each other now, and we look forward to what we're all going to do going forward.
Thanks to my guests, Tom from North Richmond Community Health, Peta from Cultivating Community, Sally from Belgium Avenue, and my Vox Pop guests, Anna, Mary, and Kingston. Thanks for sharing your thoughts and experiences, and it was good to learn how pandemic need and local collaboration have driven innovative ways to serve our food insecure community members. And I love to see all the great work that you've done. I admire all the work and the effort that you've put into it. So thank you. That's it for today. Thank you for joining me. I look forward to being with you next time. I'll see you then.